Healthcare reform. It's a debate that has been going on for decades. Well, it's heating up now as lawmakers get closer to passing a bill.
But as they talk about coverage and cost, it's the personal stories that make this debate so important. New at 10 tonight, News Channel 8's Mark McPherson joins us live now with part one of our series, Getting to the Heart of Healthcare.
Well, Mike and Martha, in the healthcare debate, many times we hear from people who are battling a disease and don't have health insurance or lost it when they needed it most. But there's another side to the story. It's the people with health problems, health insurance, and quality care. They're afraid of what might happen if the government gets involved. A typical day for little Savannah Utesh includes math homework and reading lessons.
Did you do your reading?
But considering where she is, her day is anything but typical.
Her days are very busy.
Savannah is at the end of a 3-week stay at Mayo Clinic in Rochester, where she had surgery that's kept her off her feet.
She cannot walk. For 3 weeks, she has to stay off of her feet. They don't want any stretching, the incision site, so she's doing well.
Surprisingly well when you consider this little girl hasn't stood up for weeks. But it becomes even more surprising when you find out this isn't Savannah's first surgery. In fact, it's not her 5th or 10th or even 20th.
Total right now is 40.
40 surgeries. And Savannah is just 8 years old.
She was born with spina bifida. 3.5 months after she was born, she was back in the hospital. She was med-flighted to Mayo. She got a trach put in. 2 days after that, she had a belly tube put in. She has had multiple shunt failures. She has now 2 shunts, and both tubes are going down into her stomach cavity. Oh, I can't even begin to go through all of them.
Savannah's problems began at birth, and since that day, every step of the way,
what is that?
Her grandma has been by her side.
You did really, really well.
For this latest stay, Patty spent 3 weeks in Rochester, helping Savannah's parents get through this tough time.
My daughter and her husband have to go back and forth to work. They have to pay their bills. They have to keep the insurance going, so they can't be here every night.
It's a selfless act of a grandmother who calls Savannah her favorite subject to talk about, and it's her love for her granddaughter that led her to do something she never thought she'd do.
She is important to us.
We first met Patty and Savannah this past summer. The healthcare debate was getting heated, and town hall meetings were turning into shouting matches. Most speakers at the Toma town hall wanted to tell people what they thought might happen if reform passed. Patty wanted to tell Savannah's story.
She was born with spina bifida. She has had multiple surgeries.
Patty is the first to tell you she's no public speaker.
I must have shook for a couple days because I've never done anything like that. I'm not a public speaker. I never will be a public speaker. I don't want to be a public speaker.
But with Savannah in her arms, Patty wanted lawmakers to know that there were people who were afraid of what might happen if the government gets involved in health care.
I did something. I had to do something because of my granddaughter.
When would a medical panel have decided that she is too costly to save? When would they have determined that we no longer afford her?
It scares me to think that there may come a time when they're going to look at her file, and I'm sure it must be a mile high by now, and to see the cost. And it frightens me that someday they might say, well, she's too expensive. She's had enough.
It was that fear that drove Patty to the mic that day at a time when she felt lawmakers weren't listening.
I think we just have to keep writing. We have to keep emailing them. We have to keep doing this. We have to step out of our box and do what's uncomfortable to show them that we really mean what we say.
After battling for 8 years and fighting through 40 surgeries, Patty doesn't want to see her granddaughter's health care disappear now.
I hope she will continue to get the care she needs when she needs it.
Another big concern for Patty was the inefficiency of the government. Many of Savannah's surgeries needed immediate attention, and she fears a government plan would take too long to okay a procedure, and it would be harmful for Savannah. Now, when we talked to Patty and Savannah was well on her way to recovering from this latest surgery, and they were hoping to get her back in the classroom with her classmates as soon as possible. Now, you can find updates to her story on my blog at WKBT.com.
Yeah, hopefully she can get back into the classroom as soon as possible. She has been through a lot, but what are you working on for tomorrow, Mark?
Well, tomorrow we're going to hear the other side of that debate. We're going to hear from a man who supports the public option. He had health insurance his entire life until he developed stage 4 cancer, and then his health insurance company said they wouldn't cover a life-saving procedure for him. So we're going to hear his life-saving struggle tomorrow.
All right, thank you very much, Mark. Also, keep in mind, just a reminder, you can watch our special series, Getting to the Heart of Healthcare, all this week at 10.
And if you miss any of the stories, you can always find them on our website at WKBT.com.